Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Evoked responses and in anesthetic modalities. Evoked responses and anesthetic modalities. Depression of evoked responses. Depression of evoked response means there is increased latency and decreased amplitude is seen in all inhalational agents, thiopentone sodium, propofol, benzodiazepines, hypoxia and injury. That is all inhalational agents, thiopentone sodium, propofol, benzodiazepines and hypoxia and injury, all these will result in depression or increased latency and decreased amplitude. Whereas evoked responses, no effect on to evoked responses, no effect to evoked responses is seen in etomidate, ketamine and opioid and uh, Meditomidine, dexameditomidine. So no effect on evoked responses are etomidate, ketamine, opioids and dexameditomidine. Evoked responses and anesthetic agents and modalities. Depression of evoked responses is seen in the following anesthetic agents. That is, in depression of evoked responses, there will be increased latency and there is less amplitude is seen. Whereas these depression of evoked responses is seen in all inhalational agents, thiopentone sodium, propofol, benzodiazepines, hypoxia and injury. Whereas no effect on evoked responses is seen in etomidate, ketamine, opioid and dexmedetomidine.
thank you and thank you for watching.